Yeah, good morning, everybody. The topic which we have done is mucormycosis upsurge in COVID-19 scenario, a clinical laboratory correlation. I'm Dr. Janvi Prasad, HOD, Department of Microbiology, Guntur Medical College, Guntur. So, mucormycosis, an aggressive, life-threatening, mutilating, angioinvasive infection caused by mucormycosis, a delay of 12 hours in the diagnosis could be fatal. India is now facing a public health emergency of COVID-associated mucormycosis. Clinically, it can be classified as rhino-orbitocerebral, pulmonary, cutaneous, gastrointestinal, and disseminated. The prevalence in India is 140 cases per million population, which is 80 times higher than the prevalence in developed countries. Several states in India made mucormycosis a notifiable disease in May 2021. It's a multifactorial in nature, and several hypotheses were linked to the mucormycosis. The aims of this paper is to determine the prevalence of mucormycosis among post-COVID patients and to determine the relationship between the risk factor and the mucormycosis. The methods and methodology, it is a prospective observational study from the Department of Microbiology, Guntur Medical College, Guntur, for a period of April to July 2021. And all the samples from various departments were processed for fungal elements as per the standard protocols. The demographic and clinical data was collected and was analyzed. The positivity of mucormycosis cases in this study is 10.7%, that is 75 out of 700. You can see the graphic representation also. Then about the age and sex, it is mostly the age group is 41 to 50, which is 25%, followed by 51 to 60, the mean, and followed by 60 to 70, which the mean will be 51 to 60 age group. This is the graphic representation of the males and the females. Now coming to the post-COVID days, after COVID infection, while recovering or after that, 12 to 15 days was the most common occurrence of mucormycosis, followed by 15 to 30, and then after 30 days. That is the graphic representation. And coming to the CT values, the CT values which are counted from 10 to 30, it is the most highest, that is 44% was from 10 to 15, followed by 16 to 20, that is 34.6, and 21 to 25, 12%. The parameters like CRP, neutropenia, D-dimer, and ferritin. The most common is 86.6%, that is the CRP, which is above 96 milligrams per liter, and the neutropenia is below 1500 cells per cubic mm, that is 84%. The D-dimer is followed, that is 81%, and then the ferritin. These are the parameters in graphic representation. The risk factors like the diabetes mellitus, which is the highest, like also with the steroids, 82%. Then oxygen utilization is 72%. CKD 20%, remdesivir and tocilizumab were following. These are the chi-square is 34.96 and the p-value is 0.02, which is very significant. This is the graphic representation. Then coming to the clinical presentation, this is having the chi-square 45.67 and the p-value 0.001, which is highly significant. That is the rhinocerebral, which is 57.3%, rhino-orbital 20%, orbitocerebral is 18.7, followed by pulmonary and the mandibular, all the rhinocerebral patients expired within 6 days. That is the graphic representation. And coming to the samples are more of tissues, which is 82.7, and followed by the swabs, that is 13.3, and then sputum pass, which is afterwards. These are the clinical pictures, that is the cerebral, orbital or the ophthalmic, which the direct smear is showing the aseptate hyphae. And when the growth, it is the rhizopus, we can see the tissues in the which also we can notice the growth. And then this is the rhizoids of the microscopic LPCB. And here also we can see the mouth and the orbit was included, and you can see the tissue is from the orbital, and you can see the direct microscopy with the aseptate hyphae. And the growth is this, where there are no rhizoids, this is mucormycosis. And here is the orbital and cerebral, wherein we can see the rhizoids and aseptate broad hyphae. The growth is rhizopus, and this is the tissue from which we have isolated. These are the LPCB, where we can see the rhizoids. Like there's another case also. And then coming to the discussion, the percentage positivity, the mean age group, male preponderance, post-COVID days, risk factors, and also, of course, the CT values are all in correlation with Dr. Iamm and the European Confederation of Medical Mycologists, and a systematic literature search conducted in the electronic database of PubMed and Google search, which was conducted until May 31, 2021. Coming to the conclusion, they need to monitor the situation. General public must be educated and upon the use of unproven treatment for COVID. It should be discouraged, and unhygienic use of masks also should be discouraged, and ensure the sterile water use for the purpose of humidification. Over the counter of the sale of steroids and the antibiotics